Hi, welcome to the WellMed Institute. Today we're going to be doing training module number 3, an advanced treatment using the GFT recovery. Today what we're going to be showing you is how to incorporate GFT recovery with an advanced modality called derma stamping. So let's get started.
Okay, so I have cleansed the client's skin and I have prepped her. I've also done a microdermabrasion with a diamond head. That helps to exfoliate any dead skin cells on the surface and give it a nice polished look so the skin is able to receive the next procedure we're going to be doing, which is the microneedling. So before you go in with your serum, now there are 2 treatments that you get out of one serum bottle, so just be aware if the client would like to have their neck and their décolleté done as well, then you would go ahead and use an entire bottle. If not, then you can get 2 treatments out of one. After examining the client's skin, I would let her know that I see certain areas, such as maybe on the cheekbone, on the side that faces when you're driving on the left side, that might have a little bit more skin hyperpigmentation, so I'll address that and I'll let her know that I'll be doing a little bit more microneedling in that area. And any other areas of her concern, and we'll just let the client kind of walk me through what areas she's most concerned. Some people are a little bit more concerned about the eyes, so we'll focus in on the eyes. So what you're going to want to do is take a small portion of the serum and apply it over the entire skin. By the way, the skin is completely dry. And as you can tell, I am wearing gloves to protect my hands. If we are going to be working with a needle, don't be alarmed. You may see a little bit of blood in certain areas, especially after we go the second round. Okay, so I'm going to be starting off with my derma stamp. You want to do sections of the face at a time, so you can start anywhere, but I usually start on the forehead and then apply the serum afterwards. Always ask the client if the pressure is okay. Is the pressure fine?
Perfect.
And you want to try to hold the skin nice and taut. You want to hold down for approximately 2 to 3 seconds, lifting straight up. You don't want to jiggle or move because you can actually leave kind of indentations and cause a little bit of a tearing in the skin if you do that. You want to try to work quickly around each section as the serum needs to be placed on the skin within a good minute or so after doing each section. Make sure to continuously ask the client how's their comfort level, any questions as you're going along, and you pretty much explain it as you go. So we've done the forehead portion. Go ahead and turn. How's the pressure?
Perfect.
So there are all different types of stamping needles. What I'm using here is a 0.08 length needle, and licensed estheticians, as long as they are under the umbrella of a physician, are allowed to use this, as well as nurses and physicians. So as I'm applying this, the clients usually, they'll express to me that they feel a little bit of tingling, which is just what they should be expecting to experience. careful with the lip area. It's very sensitive around the nose. Those areas you may end up puncturing a little bit more. You may see a little bit of a blood bubble, and that's perfectly fine. Just be aware that it's a very sensitive area. And then here we're ending on the left side of her face. Still pulling the skin nice and taut, sections at a time, concentrating on any area of the skin that you may want to focus on. More hyperpigmentation, like I stated, on her left cheek. Any crow's feet, wrinkling around the eye, and you can get right up under the eye, just as long as you pull the skin down. You never want to keep the skin soft, because that's where you'll find that you end up indenting the skin. And you can go right above the eyebrow. Just be really careful, because the skin around the eye is very thin. So I am going over it one more time, which we are going to go over it a second time, but I'm still working in this area. So after you've gone through the entire face in sections, you're going to go back over one more time, but the entire face all together. So starting off again at the forehead, pulling the skin nice and taut. And working just a bit quicker this time around. The skin is actually pretty sensitive by this time, because you've just finished the first round of stamping. How's the pressure?
Perfect.
If the client can take a little bit more pressure, that's better. But just make sure that the client isn't uncomfortable. This particular treatment is especially good for people that have any type of hyperpigmentation, any type of scarring, even acneic clients, as long as you're not doing it on open pustules, because you're going to be spreading the bacteria around, so you want to make sure that you don't have that type of acne. Okay, so we've done the whole face. We're going to add a little bit thicker of a layer at the very end to coat her entire face. Right now, your skin's probably tingling quite a bit. Go over the lips. This is really nice and moisturizing for the lips as well. It's very important after this procedure. So you want to do a nice massage, because you put quite a bit of product on at the end. And it actually helps to soothe the skin as well. After this procedure, do not wet your face. Try not to touch your face as much. The skin is open. It's receiving everything that you just put on it. For at least the entire day into the next day, you can resume cleansing your skin, getting it wet the following day, and make sure to follow up with your appropriate sun care. Preferably something that doesn't have chemical base to it, because the skin is probably going to be sensitive for the next few days. So look for ingredients such as zinc and titanium dioxide, so that we can continue to work, make the skin look beautiful.
So that completes the modality called derma stamping. And I can tell you right now that my skin does feel kind of invigorated and a little bit stimulated. But the serum was so cooling, and it feels really refreshed. So I'm looking forward to seeing how the results come out. One of the things I want to emphasize though is that for the first 12 to 18 hours, I'm not going to be able to wash my face or put any cleanser or any makeup on. In the morning when I wake up, however, I will put a coat of Daily. The GFT Daily is fine to use within the first 12 hours. The other thing I want to mention is if you are using retinols or vitamin C or acid-based ingredients in your products, you'll want to discontinue using those for a week after an advanced modality. After the week, you can start incorporating them slowly back into your regimen, but right now you really want those growth factors to be doing what they're going to do on your skin to help transform and heal it from the bottom up. So we want to thank you for your time and your attention, and we look forward to showing you my results in a before and after video. Thank you.